लेकिन आई थिंक इट्स ऑल्सो इम्पॉर्टेंट टू स्टार्ट एट द रूट. हम डिप्रेशन फील क्यों करते हैं?
क्योंकि we are told that we don't fit in. What we need to really understand is that this can happen to us and we need to be prepared for it. But what else causes depression? Let's look at some of the common causes of depression. It can be biological. हमारे ब्रेन में केमिकल है जिनको न्यूरोट्रांसमीटर्स बोलते हैं. Changes in these brain chemicals may cause or contribute to depression. It can be personality, certain personality traits such as low self-esteem या ज़्यादा self-critical होना make you more vulnerable to depression. Also, when we look at it cognitively, people with negative thinking patterns are more likely to develop clinical depression, जिनको बुरे ख्याल ज़्यादा आते हैं. It can also be related to gender. More women experience depression than men. And this may include the hormonal changes women go through during menstruation, pregnancy, childbirth, and menopause. Co-occurrence with medical conditions. Depression can happen with diseases like heart disease, cancer, Parkinson's, diabetes, Alzheimer's, and hormonal disorders. When we talk about medications, to understand side effects of some medications can also bring depression. Alcohol and drugs. कुछ लोग alcohol, cannabis या दूसरे drugs use करते हैं. This affects the brain chemistry in some ways and again can increase the risk of depression. It can also be genetic. A family history of depression increases the risk of developing the illness. Genes or environmental factors का combination again contributes to increasing the risk.
Life events also, I'm sure, have some part to play in depression, you know. So what about life events?
Yes, absolutely. Stressful life events, difficult life events including divorce, financial problems, or a death of a loved one can contribute to depression. Early childhood trauma or abuse, जब हमें traumatic experiences होते हैं, वो हमारी mind को affect करते हैं and make us more prone to developing depression.
See, I'm also a little bit confused about the symptoms because they can come off very, generic. So how do we be sure कि ये depression ही है, not something else? What are some of the symptoms of depression?
It's difficult to generalize, but depression कुछ लोगों के लिए एक या one time episode हो सकता है, while some may experience recurrent episodes of depression throughout their lifespan. डिप्रेसिव एपिसोड्स में आपको ऐसे सिम्टम्स हो सकते हैं. दिस इंटरफियर्स विद द इंडिविजुअल्स नॉर्मल फंक्शनिंग. सम ऑफ द मोस्ट कॉमन सिम्टम्स ऑफ डिप्रेशन इंक्लूड feeling low or sad most of the times, lack of interest and pleasure in activities which were earlier enjoyable, fatigue and tiredness, lack of energy, feeling of guilt, worthlessness and hopelessness, anger outburst, irritability or agitation, even over small matters. It can be sleep disturbances, including insomnia or sleeping too much, reduced appetite and weight loss, or increased cravings for food and weight gain, slowed thinking, speaking or body movements, impairment in normal day-to-day functioning. And as these symptoms actually highlight polarities, sometimes it is too much sleeping, sometimes it is not sleeping at all. Sometimes it is loss of appetite, sometimes it is craving for something. And so it's very difficult to understand and generalize it. ये discussion थोड़ा मुश्किल है. So before we continue, I want you to take few minutes to just ground yourself. Can you practice some deep breathing or grounding exercise that we discussed in the last module? I want you to do that before we continue.
So, now we understand what is depression, where it comes from, and what we can do about it. But I'm curious if there are different types of depression. So, could you tell a little bit about that also?
Yes. As we saw before, depression multiple reasons से होता है. I also want to give you a word of caution. प्लीज मेंटल हेल्थ इश्यूज को सेल्फ डायग्नोज ना करें. अगर आपको लगे कि आप अपने इमोशंस को कंट्रोल नहीं कर पा रहे हैं, देन इट माइट बी टाइम टू चेक और सीक हेल्प फ्रॉम अ मेंटल हेल्थ प्रोफेशनल. Just a few tick marks on the symptoms doesn't mean it is depression or any other mental health condition. And it's very necessary to keep that in mind.